So the sympathetic nervous response, when we're feeling threatened either physically or psychologically, there's a whole host of body changes that occur in order to prepare us to defend ourselves or keep ourselves safe. And then with the parasympathetic, this is where we recover from, when we activate the parasympathetic, or when it is activated, we're able to recover from the stress response. As it relates to vulvodynia and other pain disorders, when we look at the organs that are impacted or the muscle expression that's impacted, there is a contraction of the vaginal muscles, there's a limitation of the blood flow, and then also there are more stress chemicals that are released that over time can cause tissue inflammation. So if somebody's in a chronic state of sympathetic response, then they're chronically experiencing tight muscles and nerve inflammation. So while we need both of these branches, both the parasympathetic and the sympathetic, to be acting in a healthy balance together. And if they're not, then what happens is we get a dysregulated system and there's chronic stress of the autonomic nervous system. A lot of people, especially a lot of women that I've worked with, express that they have been able to tolerate the chronic stress that they experience. And while it can produce a lot of great work because somebody is really focused on doing their work and being a mom and managing the household, what ends up happening is that they become a highly stressed individual, and it relates that information back into the body. So I've had clients who have actually labeled themselves as type A or perfectionistic or just a chronic producer, and this just seems to be a common thread. So it helped me understand more of the link of chronic stress and how it plays into the role of vulvodynia. So this can also cause other chronic pain issues, other diseases, irritable bowel syndrome, and just overall chronic fatigue and stress in the body. So one other thing to understand is how we get stuck in a dysregulated state. So I've already talked about one, just having chronic stress can be a major component to it, but also when the nervous system or when the person feels like they are powerless or overwhelmed or experience something of too much, too fast, too soon, the nervous system remembers the situation that they're experiencing in which they feel powerless. The nervous system remembers that situation and starts to log it as a threatening experience. So then our brain and our body starts to remember those situations specifically, but then they also start to widen the understanding of what is threatening to other situations as well. So for instance, if a woman has pain during intercourse, the brain and the body might start to link sex with pain. But then it also might start to widen the view and notice that, well, every time my husband comes toward me and tries to hold my hand or gives me a kiss, he wants sex, and then sex leads to pain. So now the body and the nervous system will actually start to register as any sort of intimate approach from the husband might mean pain as well, and so there's an avoidance that the body puts out. So there are also some other ways that might impact or create a nervous system dysregulation. And this might be trauma, so some sort of an overt trauma like physical abuse or sexual abuse, but there also might be, and we call those big T traumas. We call those big T traumas. The little t traumas are ones that we're not usually expecting to be considered as a trauma, but we're seeing that the nervous system reacts in the same way as the big T traumas. So the little t traumas might be that chronic stress, chronic pain, experiences of neglect or abandonment at a young age, or even a sex-negative culture or oppressive messages around sexuality. So our body and our brain starts to register that these experiences can be a threat to the system psychologically or physically.